Hello, this is Elliot Antman speaking here in Los Angeles. I'm chair of the Committee on Scientific Session Program for the American Heart Association. I'm actually chair of the National Advocacy Coordinating Committee for the American Heart Association. So we are now one day after the election. And from the perspective of the American Heart Association, I think we can say that we have had a very prolonged period where the nation has been thinking about who they want their leader to be. That decision has now been made by the nation, and we now need to turn our attention to the task at hand, which is an important and complicated one. From the Heart Association's perspective, our mission is to build healthier lives free of cardiovascular diseases and stroke, and we remain committed to that and hope that our elected officials can work together so that we can provide access to care, preventive measures, and the kinds of treatments that we know patients who have or are at risk for heart disease and stroke sorely need. And we are as energized as ever to work with our officials in Washington to protect that kind of blanket that is so important for our patients. The Affordable Care Act is an opportunity to provide patients access to care. And for patients who are or have or are at risk for heart disease and stroke, the Affordable Care Act does help them. And the way we might look at it now is that the Affordable Care Act appears to have a greater chance of being implemented and reaching those patients who actually need that help. So we look forward as the Heart Association to working with our elected officials to try and do what is needed to improve the care and health of patients with heart diseases and strokes. It is another equally important fact for us that the research that we were just discussing here at American Heart Association Scientific Sessions in Los Angeles is in many cases funded by the National Institutes of Health. And as we face the fiscal cliff and the risk of sequestration early in 2013, we have to be vigilant in our advocacy for protecting the NIH. In fact, of the 27 trials, late-breaking clinical trials that we reported on here at the AHA sessions, 1/3 were actually funded entirely or in part from the National Institutes of Health, and in particular the National Heart, Lung, and Blood Institute, and we're very interested in trying to protect that funding for the future. An important message for cardiologists is that we've heard so much here at AHA sessions in Los Angeles about breakthrough research. But throughout the entire meeting there was a constant theme reminding us of the importance of heart-healthy living and preventive measures. Let's not lose sight of that. It's so important for our patients.